It says, "Hi, I'm Amelia, 35 years old. 5 years ago, during my pregnancy, I experienced significant gum issues when I neglected to treat. Now I've been diagnosed with stage 2 periodontitis, and some of my teeth have begun to loosen. If I choose laser gum therapy, can my gums return to normal? How many sessions of laser gum therapy should be necessary?"
So more than likely, either we are going to recommend either a simple deep cleaning, or more than likely, if you have gone through what you're describing, you had some issues during your pregnancy, more than likely your teeth are starting to get loose. We may not just simply recommend a deep gum therapy, which is the scaling and root planing or a deep cleaning. And most of the time in our office, we are recommending a laser assisted deep gum therapy. That's what I think it sounds like you may need. But if it is advanced to the degree it is very advanced, then we may recommend doing a laser gum surgery.
Can her gums return back to normal?
Absolutely, yeah. Thank you for reminding me. Yes, her gums will return back to normal as long as you follow our recommendation. And one more thing that we recommend: patients come here and then they listen to us and then they are thinking that, okay, one and done. Absolutely not one and done. And part of the reasons why you are coming here, because you are not been going to the dentist on a regular basis. So after getting the one and done laser gum treatment or the deep gum therapy or the laser gum surgery, you need to come back every
3 to 6 months.
3 to 6 months. Correct.